At this very moment, as we speak, the CDC advisory panel is meeting to decide on the next major step in fighting this pandemic. They're set to vote today on whether to approve Moderna and Johnson & Johnson booster shots. They will also decide on whether to allow mixing and matching vaccines and boosters. And all of this comes less than 24 hours after the FDA authorized the extra shots for millions of Americans. I want to bring in Dr. Aditi Nerurkar. She's a physician at the Harvard Medical School. Dr. Nerurkar, let's just start there. I mean, what do you make of the FDA's decision, and what does it mean practically for anyone who's eligible to get a booster?
You know, Craig, I think this is a wise decision, and I'm eager to know what the CDC decides. We anticipate that this will be very much aligned with what the CDC recommends. This decision is long awaited and long anticipated. We know many countries, including the UK, Canada, and Italy, have been mixing and matching for a long time with good results. We know that mixing and matching leads to a more robust immune response, and especially with the winter coming, that's incredibly important.
Why does it lead to a more robust immune response? Explain that for us.
So what we think happens is that when we mix and match vaccines, it creates a broader immunological response. And so what we are seeing with early evolving data is, for example, with Johnson & Johnson, getting the second dose of a Johnson & Johnson vaccine leads to a 4-fold increase versus adding a mRNA vaccine to an existing initial dose of a Johnson & Johnson vaccine can lead to a 76-fold increase.
So instead of recommending it, it sounds like perhaps they should suggest it. No?
I think that what's likely going to happen with the CDC is that the recommendations from the CDC are going to be very much aligned. You know, at this time, the FDA has suggested that 15 million Americans who received the Johnson & Johnson vaccine are eligible and should receive the booster with an mRNA, hopefully an mRNA based on the data. And then for those who've received the mRNA vaccines, should, if they're over the age of 65 or 18 to 64 with a pre-existing medical condition or high exposure, which, by the way, Craig, that is about 60% of the population in the ages of 18 to 64. So that's a very large number of people who will soon be eligible for boosters, hopefully as early as this weekend.
So, Dr. Nerurkar, I want to turn to something that we've discussed before on the show, this mysterious COVID-related inflammation in kids, multi-system inflammatory syndrome, as it's called. Doctors still searching for a cause. So far, more than 5,200 kids have been diagnosed in this country with it. Throughout the pandemic, we've seen it send kids to the hospital about a month after they were infected with COVID. How dangerous is it, and why has it been so hard to figure out what's causing it?
This is a very dangerous phenomenon, Craig. Like you mentioned, 5,000 children out of 6 million who have been infected with COVID have gotten this multi-system syndrome. So that's a very low number. Less than 1% of children get inflicted with this. But of that less than 1%, 80% need ICU level care, including mechanical ventilation. So this is a conundrum and something that we're really trying to work out. This syndrome typically occurs 1 month out, though as early as 2 weeks. And what's interesting about this is that it is not correlated with the severity of acute infection. So children can have a mild COVID illness or asymptomatic COVID illness and still get this multi-system disease. All the more reason to vaccinate children who are eligible, and for children who are not eligible, vaccinate the adults around them.
Dr. Aditi Nerurkar. Dr. Nerurkar, thank you. Thanks so much for your time and your insight as well. Appreciate you.